I have to go to the doctor, and the doctor confirmed, yes, you have pre-diabetic test result on your blood glucose. So and then the doctor sent me to a nutritionist, and the nutritionist asked me, what are you eating? So I started from breakfast all the way to my dinner, and she's holding those. The nutritionist was holding those sachet of sugar, and every time I talk like, oh, I'm eating bagel and bread in the morning, she's filling up a bowl with those sachet. And when the session was over, she goes, look how much sugar you're putting in your system. So then I understand that I have to cut down on pasta and my most favorite food, which is rice. You know, we Filipinos are very good in eating rice, to the point that when we arrive to any countries of the world, we could eat whatever is there, but eventually you have to look for rice.
Mm.
So that's a given. We have to eat rice. So and
Lalo na
then
po dito sa Pilipinas. Naku, parang ang hirap ng walang rice.
yes,
Oo.
and then I was sent to a specialist, wherein the specialist told me this diabetes is a silent killer. It slowly fill up your veins and arteries with a coating of sugar that you could lose your vision, you could go blind, and then if you have wound, they won't heal, and gangrene might sets in, and then you could lose a leg, limbs, and things like that. So it's not a joke. You have to be serious. So I keep that in mind, and then the doctor gave me a maintenance medication so that I could control the level of sugar, because especially like Pepsi, juice, they say don't avoid those because it could spike up the sugar level in your blood. And your blood is supposed to like provide nutrients, not sugar or cholesterol, as it flows through your circulatory system. So I keep that in mind, and then go through the go through that routine of taking the maintenance drug that the doctors prescribe me. But unfortunately, my blood sugar keeps fluctuating. It's like treating the symptoms but not the root cause. So next slide, please. So you could see the readings that I had, and I could go even up to 12. This is the readings that we have here in Canada. I think that's like 1, 2, 3. In the U.S. and Philippines, it's like by the hundreds, different. It's like centimeter and inches. And so I was told that 7 would be your level, the good level that you should have. That's the optimum level that you could have in your bloodstream. But you could see it way go over like 7, 9, up to sometimes 12. So you could only imagine how much coating of sugar goes to your veins and arteries. And I even have a glucometer, so I could measure my fasting blood sugar level. And that's the glucometer that you could see right now on the screen. Also, the doctor advised me to have a 3 months laboratory test of the blood sugar that I have in my system. But slowly, as in 30 years, I could only see my blood sugar reading going up and down to that my every time the laboratory test result comes out, the doctor will increase my prescription drugs. Good thing that in Canada, if you have work, then you got insurance for prescription, so all the drugs are free. And to see the doctor, I don't have. It's all covered by the Ontario Health Insurance Plan. But the thing is, with blood sugar not controlled completely, it even increased my blood pressure. So then, with the sugar increasing and the blood pressure increasing, the doctor keep adding the dosage. So I started from a few metformins to the maximum metformin drugs that I could have. Then he added diamicron. Then he added next slide, please.
So,
Diamicron.
padami ng padami yung gamot nyo pala, no, yung dosage. So,
Yes,
meaning
that's
po,
correct.
kawawa naman
Then,
ng ating liver.
yes, liver and kidney.
And kidney, yes.
Yes. So then I have Forxiga. Then you could see the long list of medication that I have. Good thing it's all covered by insurance. Can you imagine if you will be paying all of this from your pocket? That's too much. But even though it's covered by the insurance, like what you said, my main concern is my kidney and my liver. At one point, the doctor told me that your kidney is leaking protein. So in my mind, I'm not a medical person. I was thinking like, oh my goodness, that protein should be used by my body, but instead it's leaking out and getting thrown away as a waste. So finally, then as it keep increasing, next slide, please. I have the new medication called Ozempic. This Ozempic is something that you inject to your stomach so that it will regulate the insulin hormones of the body. And I feel disgusted every time that I inject that. It first of all, it hurts, and second, I see some bruises where the injection is made. Even the glucometer, you feel jumpy when you prick your finger, have a sample of blood to test the blood sugar level.
So, mentor, kayo na po yung gumagawa niyan sa sarili nyo.
Yes, they on a daily basis. So
Every
I know my fasting blood sugar, and I try to watch what I ate and measure according to Health Canada. Health Canada is suggesting that because it's in the benefit of the Canadians to follow the Health Canada rule, because the insurance is provided by the government for health of the Canadian. So they issued a pamphlet where it says half of your plate should be vegetable, 1/4 should be meat for protein, and vegetable and fruits which should be half, and then 1/4 should be protein, and 1/4 only should be for carb. But we Filipinos, we ate more than half of rice on our full plate. Yes.
Oo.
So and as the dosage increases, it brings me down. My emotion goes down also. But like what the specialist told me earlier, that it's a silent killer, I noticed that I started having a worse indication as where you urination frequently is one of the symptoms, and I see that it's getting worse to the point that I have to be close to a washroom and I cannot travel far, because every now and then you have to take a leak. So that's when I went to the doctor and asked him, hey doctor, how come it's getting more frequent than before? He goes, okay, you go for an ultrasound. So ultrasound is covered by government insurance, and then I go there and they took the ultrasound thing and they found out, and what they said is like, oh, your prostate is enlarged. So another medication comes to me. So my medication is like going on top of another.
Gaano kadami po yung tinitake nyo? Capsule po ba yan? Mga...
Oh, that's a lot.
That's a lot.
Slide,
How many?
next slide, please. I think it's on one of the slide.
Okay.
The list is there on the slide, and also I was given by the pharmacist a blister pack because if you go from one bottle to the next, you might forget one. So a blister pack was given to me, and for noontime education is there. I just pop it, take all the drugs there, and then the dinner time, pop the next blister and take the drug. So I have a 7 days set of blister pack. Actually, every month I'm receiving those blister packs, so to make sure that my debit is under control.
Yeah.
But it comes to a point also that I'm losing control of my left leg. So when I basically walking, I had to pull my left leg, and my wife said, "Oh, maybe you have a stroke or something. Go to the doctor." So I went to the doctor, and then the doctor said, "Oh, go to the hospital right away." So we went to the hospital. Here, hospitalization is for free. All you have to do is pay for the parking on the parking lot. So then I have my MRI, and then they found nothing. So then they gave me a neurologist and interpret everything, but they don't find. So the advice they gave me is go for a physiotherapist, and the physiotherapist was saying, "Oh, take a half hour walk every day and make sure that the blood." I realized that physiotherapy is like making your blood flow in the particular part of your body that needs nutrients and the blood to take out the toxin and get rid of it.
Ayun.
So
Mr. May question lang ako. Nung nandun na po kayo sa stage na kasi parang from diabetes, nagkaroon ng elevated blood sugar, tapos yung prostate nyo din na enlarged na. So parang ano na siya, nagsa-side effect na yung mga other medicines or dun sa sakit nyo. Ano po yung pinaka-kinakatakutan nyo that time nung medyo lumalala na yung sakit nyo?
Losing vision and losing limbs, because I also realized that our best friend in where my wife works before in the hospital, and we have my child's godfather is a cardiovascular specialist. He's a doctor, and he also have diabetes on his system. And then we later find out that he got to have his leg amputated, and then it leads to, yes, because they have different training maybe, or I don't know exactly what had happened to him, but he is a doctor, and I cannot say his name because it's for privacy.
Yes.
But then for after that, we find out that depression sets in from his family, and then he passed away just recently. So it kind of bring me really down.
So yun nakaka-shock din po. Kasi yung iba sa mga viewers po natin, na mga mentors at sa mga nakikinig na hindi pa member or gustong may malaman about. Maganda po yung sharing ngayon ni Mentor Bert, no? Kasi dinidetalye niya yung experience niya talaga dito sa diabetic. And yun nga yung term, it's a silent killer. Pag pinagpabahala mo, hindi mo siya tinreat, no? Pwedeng yun yung mangyari. And nangyari nga doon sa doctor pa na kakilala nila. Doctor na yun, pero na-amputate and eventually namatay kasi siguro, no, di natin alam eh. But, ayun nga, it's a silent killer, this diabetic. If you don't treat it, madaming complications and sobrang hindi maganda yung complications niya. So it start with sa sugar. So pero mentor, another question. Sige. Yun medyo medyo detailed po yung sa journey na po no dun sa inyong current na disease. Question, sige. Paano naman po sa inyo, paano nyo na nalaman tong barley, no? Paano na yung naging journey nyo about IM Worldwide? Sino nag-introduce sa inyo? Paano nyo nalaman tong produkto natin?
Yeah. Okay. So when I see that what had happened to our doctor's friend, I started writing my last will, and I started.
So umabot na kayo sa ganung point. Grabe. Pero, oo, medyo kasi po no? Hindi natin, sabagay, hindi natin maano yan, pero nakakakaba din po kasi talaga. Pero yun, sige po. Ano pong nangyari after nun?
Then I started sorry. So
sige lang po, mentor.
So I started my daily prayer. And what I was praying is like, God, let me follow your will. And put me into the destiny for which you have created me. I'm sorry.
Okay lang po.
And the next slide, please. And the prayer was answered when an angel mentor comes along. She is the best friend of my wife since childhood in the elementary, and she gave us a sample of the amazing pure organic barley in sachet. So, and on the beginning, I am not interested with it, but my wife kept insisting, hey, go, take it.
Buti makulit si wife nyo po, no?
Yes.
Buti na lang.
And what I am doing is, I said, oh, I got my breakfast already, and it says half an hour before meal or 2 hours after meal. And I said, oh, I forgot. So she kept pushing me to do that, and I remember that every time she's pushing me, it's for good reason. Just like when I have a severe stomach pain for a day, and then the next day it was okay, and I said, oh, I feel fine. And she goes, go to the doctor. I went to the doctor. The doctor didn't find anything, but he goes, okay, go to the hospital and have your blood test. This hospital have all the tests that you could have. So I went, parked the car, and then I said, I'll be leaving soon anyway. And then, but when the test is over, he goes, oh, you have a ruptured appendix. So we will get you operated tonight. Oh my goodness.
Grabe.
So that's another life-threatening condition that I learned that I have to listen to her. So I finally started with the first sachet, and like I do every day, test the blood glucose that I have, and I was surprised when I see it down. Next slide, please. And on my glucometer, it's going down.
Grabe,
So
from 9.7 no, last year. Kanina, ino-observe ko eh. Ngayon, 6.5. Ang laki ng binaba.
yeah, and it's a regular blood glucose system that we should have.
That's the regular. Mas mababa pa nga, oh. Pero, mentor, gaano kadaming barley sachet ang tinitake mo?
On the beginning, I just started with 1.
1. Okay. Gaano katagal yung 1 sachet tapos nakita mo yung result?
The first time I have it, I saw it went down already.
So sa isang sachet, tapos nag-test ka, ayan na yung resulta kanina.
Yes. I was so happy with the result. But then, on my mind, I said, numbers, maybe something wrong with my glucometer. Maybe I ate something that's different.
Nagdudahan mo pa yung glucometer.
Yes. So what I did is like, okay, I want to make sure that the only thing different that I have is the barley. So,
pero sinasabay nyo sa gamot nyo. Diba?
Yes.
Maraming maintenance. Sinabay nyo lang.
Absolutely, yes.
Right.
So what I did is like, okay, I will eat the same food, do the same thing, drink the same thing, and see what happened the following day. And I was so impressed with the result that my wife and me were completely sold out about the effect of barley in my system.
So after nun, na binigyan lang kayo ng friend nyo, ano nang ginawa nyo?
So then I checked what barley is actually, because I don't know what barley is. This is a totally strange thing to me. Go through Google because this is public knowledge, no ads intended in there.
Google na yan.
And it talks about the nutrients and amino acid and stuff that our body need to repair itself. And I was really completely impressed. Then I get to know about the testimony of people taking barleys, and we were like completely sold out about it. And that we even when Mentor Brenda encouraged us to have a package, we did not hesitate. We did not even see the compensation plan. But then,
okay, barley lang, sold na.
Yes, but when we saw the compensation plan, we're even more sold out about it. That's why.
Mentor, anong in-avail nyo na package?
A Jade package, the best one.
Wow, the best. O yan na, sa mga viewers po. Okay. Ang in-avail ni Mentor Bert, Jade, no? Ang ating best-selling package. Kasi, bakit Jade ang in-avail mo, Mentor Bert?
Because we're thinking like we have when you invested in Jade package, you will have basically you will have the same value of products for yourself that I could use and share with family, because it's a genetic or hereditary disease. So if I could cure myself, I could help friends and family and whoever would be afflicted by this kind of ailment.
Po, ayan. No, parang hindi ka naging selfish, Mentor, no? Since nangyari sa'yo, you want to, tawag dito, ma-prevent na sa family nyo yung mga sakit. Kaya, perfect na na-avail nyo din po yung highest package na madaming products. Plus, syempre meron siyang buy one, take one privilege with about free vouchers.
Yeah, and I also saw this like an answer to my prayer, what I'm asking for, and it was given to me. So then we go through, we understand slowly how to help people and offer what we have, because basically it save your health and it save your wealth or pocket.
Yes. Pero no, God is good po. Kanina nararamdaman ko yung time na sinishare mo, yung na ka na po, Mentor, naiyak ka na kanina, yung nag-pray ka ng mataimtim kay Lord. Kasi nagsulat ka na nga po ng, grabe si Mentor, no? Nagsulat na siya ng last will niya. Kasi natakot siya dahil nga yung friend niyang doctor na yun, no? Pero hindi pa rin na ano yung sakit na diabetes kasi siguro pwedeng, di ba, hindi natin alam anong ginawa. But that moment when you really surrender to God and pray and ask for His will, dun dumating yung friend ng inyong wife na binigyan lang po siya ng barley, no? At ayaw niya pa ng barley nung umpisa. Hindi niya alam yung barley, pinilit lang. Buti makulit si Mrs. But ayun, no, mentors, mga nakikinig na viewers natin, no, hinahabaan namin to, gusto namin mas maintindihan nyo. Napaka-important po ng ating health. And this topic, yung kanyang diagnosis is diabetes. Actually, sa family din po namin, there's genetic din po. Meron kaming lahi ng diabetes. Ang nasa lolo ko po, yan, sa maano din yan. Pero sa totoo lang, nako, madami po talagang lumalaban ngayon sa sakit na diabetes na naging na sila, immune na sa insulin po ba, no? Tama? Yung insulin?
Yes.
And other maintenance. Yes.
Yeah.
And also, kanina yung kinikwento nyo, meron pa kayong piniprick sa inyong stomach na masakit, yes, na nagbubrus na.
That's like, I inject myself so that my insulin
parang
would be...
pinasaktan natin yung sarili natin dun pero walang choice, kailangan. Tapos yung mga gamot nyo pa na iniinom daily na parang kung gaano kadami yun, hindi ko ma-imagine. Pero ang dami na nag-prolong after ng diabetic, tumaas yung tawag nga doon yung sa tawag dyan? Blood pressure, tumaas. Tapos yung sa prostate. Tapos yung appendicitis pa. Kumbaga, madami pa siyang after effect, no? Kaya talagang silent killer po ito. Kaya mga viewers natin ngayon, wag nyo pong baliwalain ang diabetes. If you have a family history, nako, dapat nagtitik na